everyone. Thank you for joining us today. We will be starting very shortly. We want to give people a little bit more time to join, and we'll be back in just a moment. Afternoon, everyone. My name is Ashley Rosick, and I'm a physical therapist and the clinical director of Spear's Grand Central location. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the very first time. We appreciate you taking time out of your busy day to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years. We currently have 22 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, along with launching Spear Live for those who are looking to stay in and receive care along with our telehealth platform from the comfort of your home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel the most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us at your earliest convenience, and we'll get you set up with an appointment right away. We are excited to be with you today to discuss back pain. We will be discussing the anatomy of the lumbar spine, common back issues, and we will review a few exercises for you today. So get excited to get moving. As you can see, we are coming to you live from our Spear clinics. And although we do not anticipate any technical difficulties today, please be patient with us should any arise as we navigate working through this technology. Just a few housekeeping notes. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen, and you will see a Q&A option pop up. That is where you will put any questions that you may have, and we will do our best to address any that are sent our way during the webinar. It is best to put the questions in the Q&A section. If you put questions in the chat feature, we will likely be unable to get to them during the webinar. For those who are watching through YouTube Live, we are monitoring the comment section there as well, so please feel free to type in any questions. Lastly, there will be times where multiple panelists are on the screen at once, so for the best viewing experience, please select Gallery View at the top right corner of your Zoom screen so that you will be able to see multiple panelists at once. So let's talk about our goals for the day and what we're going to be covering. We're going to be reviewing the anatomy of the low back, the abdomen, and the pelvis. We're going to be identifying how the anatomy of the low back can lead to pain. We're going to discuss when to seek treatment with a physical therapist or with a medical doctor. We're going to debunk a few common low back myths, and we're going to be doing some exercises together, and hopefully those will help alleviate some pain that you have. Before we get started, I'd like to introduce our team of panelists, and we are going to welcome everybody onto the screen now. So our presenters today are myself, Ashley Rosick, and Macauley O'Connor.
Hi, guys.
Michelle Sabogal was another physical therapist from our Grand Central location. She was unable to be here today, but we did want to give her a shout out because she did contribute to this presentation. Macauley and I are both physical therapists from our Grand Central location. And we have Kathleen O'Donnell Pickard, an occupational therapist from our Spear Live.
Hello.
She will be helping us with answering your questions in the Q&A today. Just a reminder to everyone, it's best to be in gallery view so that you can see everyone at the same time. If you've done that, you should be able to see all three of us on the screen right now. All right, we're gonna get started. Kathleen, we're gonna say goodbye for now, and Macauley, we'll let you take it away.
Okay, hi everybody. My name is Macauley again. I'm one of the licensed physical therapists here at our Grand Central locations. And at this point, I have worked with a number of patients with a variety of different presentations of low back pain. And I think it's a topic that's incredibly important, especially with the COVID-19 pandemic and everybody having to accommodate to work from home. To start, I think it helps to understand a little bit about the anatomy of the lumbar spine or the low back. It is this stack of 5 vertebrae or 5 separate bones that's kind of sandwiched between the mid-back that contains the ribs and the pelvis on bottom. Each joint is carefully articulated to allow us to move freely, but there are a lot of moving pieces in here, and all of them are kind of areas of interest of ours. What you may see highlighted are the kind of yellow strands that are branching off in all different directions. These are actually nerves that exit from the spinal column and go into the body. They travel through small holes through each single one. Those holes are very, very important and need to be preserved. We'll get into a little bit about why that is important later, but the important thing about the nerves is they carry information from the brain down to the muscles of the body to help us move, and they carry information from the body back to the brain, like touch, heat, and sensation. Once they leave the lumbar spine or the low back, they travel specifically into the hips and the legs. So this slide may look a little bit busy, and that's a little bit intentional. These are the different muscles that are kind of associated with, closely connected to the low back. As physical therapists, it's our job to promote healthy movement patterns, and all movement originates from muscles in the body. The way that we look at this slide is we look at different muscle groups and the way that they contribute to our normal movement patterns. All of these muscles are involved in tasks as simple as picking up a spoon from the ground or turning a backflip, which I promise I can actually do.
I'd like to see that.
I'm not going to do it. At any point here, these muscles can be disrupted by injury, pain, or stiffness. Once a normal movement pattern has been disrupted, it leads to compensatory mechanisms and compensatory movements, which over time, which in the immediate term are pretty good. Over time, they can become more problematic and keep you from getting back to the things you want to do. This is where we come in. This is our job. Physical therapists are doctors of movement. Besides all the muscles here, you also may notice the big blue arrow that I put on here. That points to the sciatic nerve, something that is commonly involved in low back pain, but you can see how closely it's associated with all the muscles that exist here. This is going to be important when we talk about how pain in the back can actually travel down the leg, but we're going to get into that in a little bit.
So this slide shows a few common diagnoses. And this is when describing what your symptoms are is so important, because that helps identify what exactly you're feeling and what might be causing that so that you can have proper treatment. So a herniated disc is a very common way common thing that causes pain. And oftentimes with a herniated disc, you feel pain when you're bending forward. So if you're reaching down for something, if you're doing a lot of sitting, that can cause some back pain with a herniated disc. A herniated disc can also cause what we call sciatica. So that pain that runs down the back of your leg is like a herniated disc is one way that can cause that sciatic pain. Not necessarily every way, but one way that can cause that pain. Spinal stenosis is actually the opposite. And oftentimes we see this in population of kind of an older generation where it's just normal wear and tear on your spine. And basically it means that you've lived a life and your spine has moved. But we see the opposite where when you lean forward or you bend forward, you feel relief of pain. And when you're standing up straight, you have more pain. So again, just showing how it's so important for you to, express what helps you and what hurts you, what causes you more pain when you're having these symptoms. And then a muscle strain. You saw from the previous slide that there are so many muscles in the lumbar and the hip or in the hip area, right? Macauley mentioned how busy that slide was. And that's because there are so many muscles there that can cause discomfort. Oftentimes with a muscle strain, you feel like a dull, deep ache, kind of a stiffness. And sometimes a muscle strain can also cause that sciatic pain, that pain going down the back of the leg.
Okay, so from a young age, we learn very specifically to trust the information that our body is giving us. Specifically, ouch, I hurt myself and it hurts right here. With the low back, things get a little bit more complicated and the waters get a little bit more muddy. This slide is specifically to kind of demonstrate the ways in which pain from the low back, the highlighted red bones on the skeleton, can actually be felt in different parts of the body. So for example, if we take the light green boxes at the top of the low back, this is generally where pain is referred from the top lumbar segments. This makes a lot of sense. It's right at the top and it exists right in the top of that low back portion. However, as we get lower down in the back, you'll see the areas get a little bit wider and a little bit stranger. So for example, the posterior thigh, that light blue segment is actually where people commonly report pain that's being caused by lumbar segment 3, 4, 5, and the first part of the sacrum. It doesn't really make much sense as to why it feels this way, but this is a pretty common trend. This is one of the reasons why when you come in for an initial evaluation in physical therapy, we're going to be asking you a lot of questions. How does it hurt? Why does it hurt? When does it hurt? And the other primary question words. We want to understand exactly how you feel, because at the end of the day, every single low back program should be tailored to the person that is coming in for treatment. It should all be about you.
So this brings us to some common causes of back pain. And again, there are a number of ways that, something can cause back pain. One main way that we talked about before is this age-related degeneration. So similar to that spinal stenosis that we talked about previously. And this just happens over time. Improper lifting. This can be whether you're at a gym lifting weights or if you're at home lifting up a bag of groceries, if you're having to, move apartments and you're lifting boxes. Improper lifting can be a major way that can cause some back pain. And that's why it's so important to meet with a physical therapist to learn how to properly do those things to prevent any injury in the future. Work-related stresses, posture, such an important thing to make note of because we're sitting more than we've ever sat before. I mean, with COVID, we went from sitting and working at our desk for a few hours to walking over to the couch and sitting for a few more hours. We're sitting more than ever before. And sitting's the new smoking, guys. It is one of the #1 causes for back pain. So going over posture and what you can do throughout the day will really help with back pain. Similar to repetitive movement patterns. If you're doing something over and over again in a poor way or with weakness in muscles that surround the spine, it can cause some back pain. Trauma is another one. So for example, a car accident, a very common way to have back pain, and just general muscle stiffness, which can be caused by literally all of the above.
When we meet a patient for the first time, it's very important to figure out who is right for physical therapy, but it's also equally as important to make sure we're screening for people who physical therapy might not be the right option at this moment. This slide is just for reference. These are some common red flags we look for in patients who are reporting low back pain. I'd like you to just quickly scan through these. It's really important to understand that sometimes back pain can present as part of a larger and more complex medical issue that requires other intervention. If these are seeming familiar to you, or if these kind of ring true for someone that you know, encourage them to speak with their physical therapist, schedule an appointment with us, or contact their primary care physician. We just want to make sure that you're all feeling okay.
Ways to prevent back pain start with practicing good posture. We have muscles that should be working at all times, and that's what we're here today to go over with you. We're going to go over some proper posture. We're going to go over some exercises, but these things that we do throughout our day, sitting all day, we want to make sure that we're doing what we can do the most to support ourselves and keep ourselves healthy and happy and keep our spine happy. And we want to make sure that we're exercising, because motion is lotion. And that's Macaulay's favorite saying ever of all times. And you'll never forget it. Motion is lotion, and exercise is the best thing to do for your back. So with that, we're going to show the next slide. So we're going to send this to you as a reference so that you'll be able to see this, but we're going to actually show you some ergonomics right now. So we're going to hop the slide off. Yep. Okay, so for those of you who joined our webinar the last time, you know that we did go over ergonomics. It's so important that we want to go over it again. So you can see Macauley here is sitting in a very poor position. He's slumped over, his legs are crossed. This is very, very bad for your back. So we want to fix this. So the number one rule with ergonomics is 90, 90, 90. So we're going to have Macauley scoot on back up towards the desk. So first thing first, we're looking at hip and knee, them being at 90 degrees. So you can see how his knees are at 90 degrees. He's going to go ahead, he's going to straighten up his back now, and that's going to help him have a 90 degrees at his hips. The next part of 90 degrees is having your shoulders and elbows at 90 degrees too. What will help with this, if you're working from home, is you want your screen to be as level with your eyes as possible. So if you can put something underneath it, a box, a book, whatever it might be, so that you can have the screen closer to your eye level, and that way you're not slumped and rolled forward. So when we sit all day, basically what happens, we're seeing that you guys are having a hard time hearing, so I'm going to move the computer to a little bit closer, and hopefully this helps. So when you sit all day, all the muscles in your back, so that your core muscles and your glute muscles, which are the most important muscles for your spine, they turn off. So what should we do? We should stand up, right? So we want to make sure that we're standing and we're moving as much as possible. So we're going to create a standing desk. So I know I order a lot of things from Amazon. If you're an avid shopper like me, you probably have some Amazon boxes nearby in your house. So if you pull out a box at home, if you pull up some books at home, basically anything that can bring up the laptop so that you have a standing desk at home. You don't necessarily need to buy anything, but the same rules come into play. So Macauley he's leaning forward. He's doing some weird stuff with his posture. He's going to go ahead. He's going to step up towards the desk. He's going to stand up nice and tall, and that 90-degree posture kicks back in here. You want your back straight. You want your shoulders and elbows at 90 degrees. And just getting up and standing and moving is going to help bring blood to the area. It's going to get the juices flowing. It's going to give your spine a meal. That's what you want to think of, is when you stand up and you move throughout your day, you're feeding your spine. You're giving it a meal, you're giving it nutrition, and you're helping your spine and the muscles around the spine to stay nice and healthy. One other thing, if we go back to the seated position, one other thing that can help you and help support your back is you can roll up a towel or roll up a pillow, or just grab a pillow and put it at your lumbar spine. So you can see Macaulay's putting it here, and it just gives his spine a little bit more support, and also gives that cue to stand up a little bit taller. Nice job, Macauley. So we're going to come back to PowerPoint now.
Okay. When it comes to low back pain, every single physical therapist has heard at least one of these sentences at least one time in their career. There's a lot of information that's out there about low back pain, and we're really here to answer questions along with kind of diagnose and help treat the problem. So, common low back pain myth number one, I just have a bad back. We do know that a history of low back pain does predict future low back pain down the line. However, I believe that even with a recurrent history of low back pain, there's no such thing as a lost cause. Some backs just require a little bit more tender love and care to stay healthy and pain-free, whether this is through a regular stretching program, a regular strengthening program, or just increasing the amount of activity that you do in a way that you understand it. There's always a safe middle spot that you can find for your particular back. Number two, exercise and moving around is just not safe. Consistently, research has showed that movement and activity are both safe for treating nearly all types of low back pain. In fact, the parameters for PTs to treat low back pain just got released and updated again this year. And this is all kind of reiterated in their big bullet points. I always tell my patients the best advice is to respect the body where it is in terms of its healing process. For example, let's say you were having low back pain previously and you've just been able to walk without pain for about 20 minutes. This may not be the time to get back to your normal Olympic powerlifting position and routine. That's okay. That is a spectrum, and there is so much room in between those two activities that we can help identify and target areas where there can be improvement. If you remember back to the muscle slide, like I said, there's so much going on in that slide because there are so many different muscle groups that we look at. We can use each and every one of those to help identify and help you move more pain-free. That's our big goal here, and we always want to make sure that it's going to be as safe as possible. Number three, I need to scan, I need an X-ray, I need an MRI before I try any type of PT. Don't get me wrong, X-rays and MRIs are extremely important and extremely powerful tools for diagnostic medicine. However, they're not appropriate for every single patient. When it comes to non-specific low back pain, we actually know that the correlation between the things we see on an X-ray and an MRI do not correlate well to the pain that the person is having. For example, if you see this change, it doesn't equate to this much pain. We know that MRIs and X-rays should be used very specifically and at the discretion of your consulting physician to identify, rule in, or rule out very specific medical diagnoses. We may use these when there isn't as much progress as we thought, or when the key signs and symptoms just don't add up. Not everyone needs one. Number four, my back is out of alignment. It's out. It needs to be put back in. There are, of course, a couple of conditions which change the normal alignment of the spine. The biggest one that most people are familiar with is scoliosis. However, many people feel this kind of out of placeness or wrongness after just a simple single experience of low back pain. This feeling doesn't necessarily mean that something in the body needs to be relocated. More often than not, it means there's some kind of muscular issue, muscular imbalance, strength difference, or stiffness that needs to be addressed first and foremost. Number five, there's nothing I can do. I am powerless when it comes to my pain. This is where we come in. As Ashley kind of identified early in our presentation, there are specific movement patterns that we look to pair with the back pain that you're describing. We try to categorize it based on what makes you feel worse, but more importantly, what makes you feel better. Many people really aren't sure how to approach the topic of pain because it's so important and it's so critical when it happens to you. There's so much information on the internet and not all of it is reputable. Dr. Google is not always your friend, especially when it comes to low back pain. Your physical therapist, when you come in for your initial evaluation,
We'll take a detailed initial evaluation, understand exactly how you're moving, and cater your treatment program to that presentation. We don't treat low backs, we treat people here. If there is nothing that we can do, if there are no movements that feel better, and your pain is consistent, this may be one of those times where it's part of a larger medical issue and we need to involve your medical doctor. Again, PT is right for lots of people, but finding out the people it's not right for right now is equally as important to us. Myths busted.
The myths are busted now. So we are going to go over a few exercises right now. It's going to show some mobility, some stability. We're going to do some coordination and strengthening. We're going to work on some core, some posture, some glutes. All of these things we want you to do with us. If you have a mat, if you have a carpet, whatever it might be, we'd love for you to join so that if you do have questions, you can put them in the Q&A box. Again, please make sure that you are pain-free. If you're having some pain, please stop doing what you're doing and you could check into the Q&A as well. Macauley is going to start us off first, and he's actually going to go over a few exercises that help with during the day, during the workday, right? We've been talking about how sitting is what we do so much of and what we need to make sure we're getting out of and moving from. So I'm going to bring it over to Macauley.
Hello, and welcome to my office. If anybody's having a difficult time hearing me, just let us know in the chat. So this first kind of series that we put together is specifically for stretching throughout the workday. A lot of this stuff involves a chair because we know you're not going to, have a separate yoga setup unless you've got a very specific office, home or office layout that I'm very envious of. So during the day, when you step away from a meeting or when you just turn off your camera, these are some things that you can do if you are experiencing low back pain. So the first one, all of these are going to be on a sheet that we provide to you, so you don't have to memorize all of them. This is a shoulder stretch and a lumbar decompression. So in general, you want to hinge forward at the hips. Stick your butt back as much as you can. Keep your hands rooted on the back of the chair and just gently lean backwards. You should feel this all through the whole back. Drop your head. This should feel really comfortable. Again, any stretching program should be gentle and pain-free. Again, come right back down, sit your butt back, and just feel this stretch all the way through the entire back. This second stretch, the Piriformis Stretch, is specifically if you feel a lot of pain and tension down in the buttocks and low back. This is one you're going to cross it over your knee. First of all, this position should be pain-free. If you're having any discomfort at this point, I wouldn't recommend going any further. You're going to put your hand on the knee and gently lean forward. As you lean forward, you want to keep your chest up, looking straight ahead. This is going to keep the low back from slouching forward. This will feel uncomfortable. This will feel like a really healthy stretch all the way through the glute muscle. Again, very discreet. You can do it right on camera. The second one will look a bit like you're practicing ballet in the middle of your Zoom meeting, so I recommend that you try it at a different time. It is the thoracic extension and rotation. There are lots of different movements in the low back, and again, it's good to kind of go all the way up from the neck to the low back. So, first of all, raise your arms up overhead. As you do this, you'll notice how my back kind of arches. This should be gentle, it shouldn't be forced. So bring the arms up overhead and then turn your whole body like you're looking over your shoulder. This should, again, don't try to force anything. You don't want to be really ripping through the back. Just let your body kind of drift over. If you have a dog or cat, just imagining that you're looking for what trouble they're making during your workday. And you can do this to both sides. If for some reason it's not comfortable for you to get your arms all the way up there, that's absolutely fine. This isn't on the sheet, but you can use the arms of your chair to assist in this stretch. So same thing, nice comfortable arch in the back. You're going to reach your arms across and just use them to pull very gently. Again, when we see people in PT, the first time we see someone stretch, it's usually, look how far I can move. That did not feel fantastic for me. So it's just a very gentle pull into a point where you feel about a moderate stretch. This should go from the hip all the way up to the shoulder. The next one, mid-back flexion. This is probably one that I do all the time in the clinic and when I'm sitting down. So the same way that we extended the mid-back, we're actually going to round it out a little bit. You're going to take your hands, interlace the fingers, and reach forward as far as possible with your hands. As you do this, imagine rounding out your back, dropping your head to keep this stretch going all the way through the back. Just reaching out isn't going to do anything. You want to imagine you're pushing your hands as far away from your body as possible, again, within a pain-free range. There may be some pops and crackles. That's pretty normal. It's usually a sign that there is a little bit more stiffness, and then you need to stretch a little bit more. The last one is I'm going to actually abandon my good friend, the chair. And it's just a side bending stretch. So you're going to put your hands on your hips, reach up overhead, and lean your body to one side. You'll feel this all the way through the hip, through the side, and through the shoulders. This should be very, very comfortable. You should hold for about 2 to 3 seconds, about long enough to think, how long should I hold this for? That's usually my best recommendation. Between these 5, you're going to be hitting a lot of the primary movements of the low back and ensuring that they're all pain-free. We're just going to check in with the chat real quick. I see a lot of things popping up. We're good. This is the office stretching program that I've put together for you guys. Again, it's going to be made available to everybody after the webinar. So that is available for download. If you have any questions, as always, ask. The best part is Ashley's actually going to take us through some of the exercises that we use in the clinic to help people with their low back pain and talk about exactly what each one is doing.
Okay, guys, so before I hop on the mat as I fall over, again, we want to circle back to motion is lotion, right? You should at no point just be sitting all day, every day, especially if you do have any sort of discomfort. You want to get up and get moving. So if you can, take a step away from your desk and go on your floor, on your mat, whatever it might be, or at the end of your workday, just make sure that you are giving some TLC to your spine. So when we're talking about the low back, the number 2 most important muscle groups are your core muscles and your glute muscles. So these 2 muscle groups, they come together and help stabilize everything in the back. So we want to turn those muscle groups on, and that's what I'm about to show you. So we're going to hop over to my yoga mat here. All right. So the first thing that we're going to do is a bridge. So a bridge is a great exercise that helps the core muscles and the glute muscles coordinate together to support your spine. So if you're following along with me, you're going to lay back on your back, hands flat by your side, feet shoulder width apart. Okay, and the first thing you're going to do is you're going to think, push your belly button down into the ground. So what I mean by that is you should not be in an arch. Your back should be pressed up against the floor or the table, wherever you are. You should feel your back pressed against the ground. When you do that, you'll feel your core muscles engage. From there, you're going to lift up and you're going to squeeze your butt muscles. So you can see your core and your glutes come together and help stabilize your spine here. What you do not want to do is you don't want to just go up and down as fast as you possibly can and not think about what you're squeezing. You want to make sure you're engaging those core muscles, you're lifting up, and you're squeezing the glute muscles. You want your weight in your heels. So you can see I'm kind of lifting up my feet here. You don't necessarily have to do that, but you should feel the pressure in your heels. With a bridge, you also might feel some muscle working in the back of your thigh, and that's okay. That's your hamstring muscle. It's also working during this exercise. What's really important is that you go nice and slow and controlled with these. You don't want to press yourself up into like an extreme arch, and you also don't want to be folded. You want your body to be in a straight line here. So you can see if I put my arm down by my side, you can see that my arm is totally straight because my body is in a straight alignment. And usually what we say is about 3 sets of 10. So if you're doing these, if you've been doing these, you should feel the butt burning and your core engaging. I feel it. I've done like 2 of these and I'm sweating. So for the second exercise, this next exercise is called a bird dog. Very fun name. So you're going to come up onto all 4s. So when you do this, again, you don't want to be arched up like this, and you also don't want to be arched down like this. You want to find a neutral position, and when you do this neutral position, you're going to feel your core engage here. So there's a few different variations of this exercise. What we'll start with first is just our arms. So you're going to alternate lifting your arm overhead. And this is kind of the more simpler version. But the key here, I'm going to face you so that you can see. The key here is that when you lift an arm, you're not rotating and rocking your whole body, right? You should feel your core engage and the rest of your body doesn't move. So your core is engaging to stabilize your spine while your other limbs are moving. Now, another variation of this is no arms, but your legs. So again, you're finding your neutral position and you're going to kick back, come back, and then kick back again. So you can see from this position, again, it's very easy. If you're not doing this correctly, your whole body rotates. You don't want to be doing that. Your core is engaged. You're kicking back, come forward, kick back, come forward. So you can see how my whole body is not rocking. My core is engaged here. You're going to feel your butt with this a little bit too. And the last variation of this, if you're ready for the next level, is lifting your arms and your legs. So you're going to lift opposite arm, opposite leg, come back to center, and lift the other arm and leg. So it's the same concept here, where you're trying not to rock. You're keeping your core engaged, and you're not rocking side to side. And again, you're doing these with me. You might be out of breath, because I am definitely out of breath. But you should feel your core and your butt kicking on to stabilize the spine there. The next exercise we're going to do is what we call no monies, or bilateral shoulder external rotation. But what this exercise does, this is a postural exercise. I'm going to go ahead and stand up for this one. So if you have a band, you can do this with a band. If not, you can do it without a band too. That's fine. But how we talked about in ergonomics when we were looking at our desk, you want to make sure you're standing up nice and tall. Our postural muscles are just as important to our spine as our core and glutes are. So we want to make sure that we're getting those muscles activated. So if you have a band, you're going to hold the band with your palms up towards the ceiling. If you don't have a band, you're just doing the same thing. You're just going to have your palms up. You're keeping your elbows squeezed in by your side, and you're going to rotate your arms out, squeeze your shoulder blades, and then slowly come back in. Good, so I'll show you from the side. You're squeezing your shoulder blades and coming back in. What we don't want to do here is we don't want to flap our wings, right? We're not flying away. Keeping your elbows squeezed in nice and tight, squeezing those shoulder blades. And the other thing we don't want to do is we don't want to shrug our shoulders, right? We don't want to cause any neck pain. We just want to squeeze back. You're going to keep your core engaged here. And we're working muscles all along the spine. So this is a great thing to do when you've been sitting all day. If you've been sitting over a keyboard, get up, get your shoulder blades back, stand up, get the blood flowing to your hips and to your spine. And this will help with some back pain as well. The last exercise I'm going to show you is for our glutes. These are super important because, again, they help stabilize the spine muscles as well. So I'm going to grab a band for this, and I'm going to put this band around my ankles. If you do not have a band at home, again, that is okay. You can do this exercise without a band. But if you do have one, feel free to join. We're going to put this around our ankles. And I'm going to take a few steps back just so you can see. So the next exercise is a band walk. So I'm going to start on the side of the screen. So for this one, if you guys are currently going to physical therapy, you've probably done this one
100 times.
It's one of the best ones out there. But you're going to bend your knees. You're going to take a big step and then a half step. Big step, half step. So if you have a band on, the band stays tight the whole time. At no point are you stepping all the way together and the band is coming loose. If you don't have a band on, you're just thinking big step, half step, big step, half step. And you're going to go back and forth because you want to work both sides. The other thing with this one is you want to keep your core engaged, right? You don't want to just be all loosey-goosey. You want to make sure that you're actively engaging your stomach muscles here. If you're doing this exercise and this feels a little bit too hard with the band at your ankles, you can bring the band up above your knees and do the exercises like that as well. That'll give you a little bit less resistance and you can work yourself down. But I'm already feeling this in my butt. So if you're doing this with me, your glutes should be burning. And this is a great exercise to get the blood flowing and to get everything working around the spine. And again, like Macauley said earlier, we're going to be sending these exercises to you. So you'll have picture, video, and a description of what to do and how to do them. And I think we're going to hop on for some Q&A now.
We'll go back to our original office.
All right. Hello, that was amazing. There are questions like streaming in. You guys have a lot more to do.
I'm very out of breath from those exercises.
Yeah. Well, I was doing my rotations and seeing that I clearly need to be doing them as well. So
they felt good, right?
Well, I need to do it more and then it'll feel even better. But I'm going to get started with the questions because we've got a lot of them. So let's just start with this question. So I have a bend in my spine from birth. What can I do to help my back? And is there anything I can do to help my back?
Absolutely. So there are, of course, normal medical conditions that include a bend in the back. Exercise is safe, but the big thing is making sure that it is pain-free. There are some exercises and stretches that you can use, kind of on that bend. It depends on if it's called a fixed or a mobile deformity. And I don't like that term because I feel like it's negative, but that's kind of the terminology that's used. For one that's mobile, generally, there are stretches that can be used to kind of correct. Otherwise, it's really about moving, strengthening the muscles on one side, the side without the curve, to make sure that the kind of resting pull on the spine is a little bit higher. So if that's the curve of the spine, we want to pull everything back this way. So it would be strengthening on the left side of the body over here to kind of pull everything back in. This is kind of a situation that affects you. And I think that, finding somebody that is willing to talk through these options and find ways that you can exercise without any discomfort is extremely important. High impact activities may not feel the best in the world, but that's no reason that you can't do normal weightlifting with free weights, barbells, kettlebells, any other kind of bells that you can find that have weight to them. I hope that helps.
Amazing. All right, we'll move on. Thank you for that answer. What typically causes nerve damage?
Ooh.
And that's a loaded question. There's a lot to answer.
Yeah, I think there's not one answer to this. I think, similar to back pain, right? There can be so many different causes, so many different reasons for it, that it's hard to give just one reason for nerve damage. I don't know if you want to add anything in there.
Yeah, with nerve damage, there can be a specific cause. excessive compression to a nerve over a period of time can cause damage, can cause the nerve to actually die off. They do have a good opportunity to regrow. There are also medical conditions that can involve some level of nerve death. Diabetes is one of them, involving numbness and tingling of the fingers and the toes. It really depends, depending on your diagnosis. If it's from the back, generally we do see that these have good abilities to reverse themselves.
Yes.
In cases where they're not, we may encourage you to talk to an orthopedic surgeon or someone like that.
With certain nerve-related injuries involving the back, there are definitely exercises and stretches that can help with the symptoms that you're feeling. So similar to like numbness and tingling, like those types of, nerve injuries, there is an array of different exercises that you can do at physical therapy that kind of can help attack those symptoms and decrease them.
Amazing. So moving on, there's a few specific questions about diagnoses, and I just thought I'd run them by you, but I'll give my little spiel that if there's specific questions, I think it's best that you guys in the audience come see one of the physical therapists. They'll be able to give you a more specific answer for these questions, but I thought I'd throw just a few of these in. So someone had written in, I have spondylosis. Do you have any suggested exercises?
Yeah, so with spondylosis, it's highly variable, and it really depends on what you're having the most difficulty with. With spondylosis, generally we think kind of movement in forward and backwards is usually very difficult. Also twisting, very difficult. I would recommend kind of keeping things in with a simple plane of movement. So what are called kind of straightforward, that are not compound exercises. So for example, if you think of a burpee, which is, drop down to the floor, do a push-up, drop back, jump back up in the air and jump in the air. That's a lot of moving parts all at once. I encourage you to start with kind of the breaking it down. Try a push-up. Is that pain-free? Try a jump. Is that pain-free? Slowly progress your resistance and your complexity in a range that's pain-free.
Amazing. Thank you for that. Moving on to a question about stenosis. So is there different treatment for congenital spinal stenosis and age-related degenerative spinal stenosis?
There shouldn't be. Generally, stenosis is a term. It's a term that's used for narrowing of the space in the spinal canal. There shouldn't be much of a difference between the presentation, what it looks like on an X-ray or an MRI. The big thing that we're concerned about, is it different when you are here in front of us? Mm-hmm. If bending forward, as is commonly feels better for most people with stenosis, does not feel great for you, we're not going to ask you to do that. We're going to find different ways. We're going to find different methodologies. And we may encourage you to seek professional advice if it looks like it's not responding to PT.
And I think similar to what Macauley said earlier is everybody is different, but we want to keep you in a pain-free range. So whatever type of stenosis it is, you're probably going to show symptoms similar. But when you're at PT or when you're doing exercises, you just want to stay in a pain-free range.
Awesome. And then another quick just stenosis question. It seems like you kind of answered this with that last question, but is spinal stenosis in the low back the same as spinal stenosis in the neck?
The term stenosis means the same thing both in the low back and the neck. However, there are certain different implications in the neck and the low back respectively. In general, as the nerves kind of come out from the brain down the spinal canal, there are a lot more that are present in the neck. So there tends to be less room for movement. Cervical or neck stenosis tends to be a bit more highly irritable. It's easier to bring on your symptoms than it is in the low back. Everyone wants to respect that and make sure that you're avoiding the symptoms that you're probably experiencing with stenosis. Numbness, tingling, stuff like that, making sure that we're adjusting our exercises accordingly.
They are the same thing in terms of degeneration, though. It's just in different parts of the spine.
Amazing. Thank you. Going back to some questions about the exercises. So you guys showed that figure 4 stretch. Are there any other stretches or exercises for a tight piriformis?
Yeah, we can show them.
Sure.
We can hop on the mat.
We can go back to our previous office.
So if you want to get out of the chair and you hop back on your mat, you're going to do a similar thing that you did in the chair, where you're going to bring your ankle to your other thigh. And so like you see me from this direction, you've got a figure 4 position, okay? And so then if you do that, you're going to hug that thigh into your chest. And the leg that is crossed is the glute that you're going to feel it in. So I'll cross my legs so that you can get this way too. So you're making your figure 4, and then you're going to hug that thigh in, and you should feel this right in that piriformis, right in that hip. If this is too much for you, if you can't lift up your thigh, which sometimes is the case, you can hug your leg in and hug it towards your other shoulder. So when you're doing it, you're not like, this is not rotating your whole body. You're just hugging it diagonally across your chest, and you should feel that in your butt. And this feels really good right now. You're hugging it across if you can't do that figure 4 stretch.
Amazing. Thank you so much for sharing those. We've got just a few more questions that we're going to try to get to. This might kind of go hand in hand with some of those, I apologize, some of those other exercises you just showed. Are those exercises good for sciatica?
The exercises that we did during the webinar,
Yes,
they definitely,
the ones you just showed.
the piriformis stretch that we just showed is a great one for sciatica. And the exercises that we did on the mat are very common ones that we do with patients who have sciatica. Again, everybody is very different, and you want to stay in a pain-free range. But those exercises help, again, turn on those muscles that stabilize the spine to help with that injury to the spine.
All right, you guys are full of info. We have 3 more questions that I think we have time to get to, so let me just hop into these. So for long distance flights, what are some exercises that people can do to kind of manage the discomfort of sitting for a while?
That's a great question, yeah.
And this actually goes for both flights and traveling by car, because very similarly, we see problems in pain with both of them. So again, this is with the same caveat that we've been talking about the whole time. If these feel good for you, then go with them. A general rule of thumb is once you get on the plane, you can ask for an extra blanket. They have tons of them all over the place, and you can use them as kind of cushions and pillows. Generally, the actual pillows that they provide you on planes are way too soft. They don't really do anything. But if you take the blanket that they give you, fold it into, let's say, fourths, and then roll it up into a tight bundle, you'll have a nice roll that'll look very similar to the ergonomic cushions that they sell online. One of those directly against the low back. So if you are sitting on the plane, you can either put it, I wish I had it. Here, you know what? Sure.
He's grabbing something to show you. Here we go.
Perfect.
He's using his shirt.
If you have a spare shirt, you can use that too. But bundling it up into something that is a very, very messy roll, you can either put it horizontally across the back and kind of pin it to the bench. You'll see that this kind of promotes a more upright posture. It blocks me a little bit from slouching. I can be really determined about it. The other way you can do it is vertically along the spine, put it right here, and it'll do the same roll. The big rule of thumb, whenever you're traveling via car or by airplane, is you'd like your hips to be above your knees. That kind of promotes a more upright posture. It's generally better, and it alleviates some of that tension on the sciatic nerve and the low back. Bucket seats have caused so much low back pain and pain radiating to the legs, where you're kind of down in this low chair that is like this for hours at a time.
Yeah.
So I encourage you to kind of get up, use the back of your chair and use anything you can to put the hips above the knees and to promote kind of normal back extension.
I would say too, a few of those exercises that Macauley did in the chair, so like that figure 4 stretch in the chair, even like some rotation ones, that can help relieve some of the pain. But I would definitely say if you're on a really long flight, it's kind of the same rule of thumb, like you should try to stand up and walk along the aisles. I mean, I have literally like gone in the corner of an airplane and stretched and been that weirdo, but then I felt fine. I felt good. I was the only one feeling good. So don't be scared to get up and walk around, because you shouldn't be sitting for that long of a time.
Amazing. Thank you. We just have one more question that I think we'll be able to get to. Could you talk a little, this is, just kind of surface level, about the prognosis and treatment of facet joint pain?
Good. Great question.
Yeah.
Very specific.
So treatment kind of comes in two forms. One, there's probably going to be some manual work. The facets are these little bridges that exist between the big blocks of the vertebrae. I wish I had more props. So the vertebrae are these kind of big blocky structures that stack one on top of the other in the low back, the neck, and all through the spine. The facets are small joints that exist between those two blocks that allow movement between them. So that's why we can get so much different motion in the low back. Facet arthritis is very common. I would say it's just impossible to prevent entirely.
Yeah.
Generally, there are going to be a couple of things. The compression between the two facets is going to be usually the primary cause of pain. So there will probably be some manual work to traction the spine or just kind of stretch it out very gently to alleviate that pain. Once that pain is decreased, we want to strengthen and stabilize around the neck to make sure that you're working within a pain-free range. I say pain-free is like a window. You open it a crack and then slowly it's just going to keep opening and opening and opening. This range where you're able to feel better and better over the course of the day is going to increase. Prognosis in terms of presentation depends on your general presentation.
Yeah.
I would say usually symptom reduction within 2 to 4 weeks, alleviation within 6 to 8, but that is a very rough guess.
Yeah. Yes. That was amazing. Thank you guys. So that is all the time we have for the Q&As. So if you guys do still have questions, don't hesitate to reach out, but we hope that today's talk was valuable. I know it was for me, and I can see in the chat that everybody is really finding all that information valuable. So I hope you learned some treatment methods and ways to improve your symptoms. If we didn't get to your question, again, don't hesitate to reach out to us directly afterwards. Your presenters for today were Ashley Rosick and Macauley O'Connor. Michelle Sabogal was also a contributor to the content of this webinar, so we want to give her a little shout out there. Feel free to jot down their contact information. You can reach out to them directly. And then Ashley, woman of many talents, was also your host today. And I was your Q&A moderator. I'm a hand therapist from Spear Live. Don't hesitate to reach out to both Ashley or I with any questions, or if you want us to facilitate getting you set up with one of our therapists. And then at Spear, we continue to treat an array of conditions from head to toe. As a reminder, we're open for both in-person as well as telehealth visits. So should you feel that you could benefit from some individualized guidance and treatment, please reach out to one of us and we can personally coordinate you with one of our team members for an evaluation. And then lastly, we are going to be continuing these webinars through 2021 and into 2022, covering a variety of topics. So we look forward to seeing you there. Follow us on social media and check your inboxes to learn more about upcoming topics. And thank you again for spending time with us today. We hope you enjoyed the webinar and we wish you all the best.